Hello, my name is Isaiah Griego, and my presentation is on the basics of wound care. Quick disclaimer, the first step in wound care is always assessment. If you believe that your wound is life-threatening to life or limb, please call 911 immediately. I repeat, if you believe it is a threat to your life or a threat to your limb, please call 911. Definition of a wound. A wound is an injury to a living tissue that results in a structural or functional abnormality. Below here are illustrations of a wound to avoid the more grotesque, realistic images, but as you can see here, they come in all shapes, sizes, and morphologies, but the care and principles of them are largely the same. Wound care and why it's important. It is estimated that about 8.2 million people presented to hospitals around the nation in just 2018 alone in regards to wounds and the complications regarding the care of them. It is also believed that the biggest barriers to proper wound care are education and resources to care for your wound. This video serves to fill the gap that is left in education. On an individual level, it can save you time, money, and years on your life to practice proper wound care. Possible supplies you might need would include dressings such as gauze, foam pads, hydrogels, antimicrobials, and transparent films. Foam pads are really just those white squares or rectangles you see on band-aids. Solutions would include isopropyl alcohol, hydrogen peroxide, sterile saline, and sterile water. The alcohol and hydrogen peroxide are more for cleaning your wounds, while sterile saline and sterile water are used to keep the dressings hydrated on your wounds. Miscellaneous things include hemostats, scissors, a flashlight, cotton swabs, pain medication, and gloves, so you do not introduce any nasty bacteria into your wound. Basic principles and steps to wound care. We'll go over the steps here soon, but the basic principles that the steps are based upon are keeping it clean to avoid bacterial load. One thing to mention is just because a wound has bacteria in it does not mean it's infected. Infection is more based off of signs and symptoms. So keep it protected. Keeping it protected keeps it from getting any further injured and can lessen the time of your healing process. Keeping it moist provides the most adequate environment for wound healing. So now to steps. Assessment. In this step, you will do a quick assessment of your wound. You should also pay special attention to the severity of your wound and take into consideration its threat to your health, your ability to provide proper care for your wound, and ask yourself these questions. How bad am I bleeding? How bad does it hurt? One thing I really want to highlight is, was it relatively clean or dirty, your mechanism of injury? If it was dirty, you might need medical intervention. For example, if you get cut by a rusty nail, this increases your likelihood of getting tetanus and losing a limb, so these things matter. Gathering necessary supplies is part of your assessment. You should be able to gather enough information for the necessary supplies. We all use Band-Aids, so we know how to use that. Gauze is used in conjunction with something like sterile saline to keep it moist and put this over your wound and provide a moist environment for it to heal. Scissors used to cut the gauze, and antimicrobial ointment to keep it moist and also keep bacteria from growing. You want to manage your pain. One of the biggest barriers to proper wound care is the lack of pain management. You want to use something like Tylenol or ibuprofen 30 minutes prior to wound care to be able to provide adequately for your wound. Clean your wound. Mechanically, this is something that involves like rubbing some dirt off or irrigating it with clean or sterile saline. Chemically, you want to use a chemical substance to clean your wound, such as alcohol or hydrogen peroxide. You want to cover it. It is important to cover your wound and make sure that you are keeping it protected from the risks posed by the environment. This keeps it from getting worse and also keeps you from getting infected. You want to assess it. The steps to wound care follow a cyclical pattern. It is not a one and done situation. You want to keep reassessing it to make sure that your wound care is adequate for its healing process, or at least the step in it. You want to monitor for infection on your assessments. Signs of infections that are most common are redness and swelling around your wound, including pain and tenderness. Other common findings are warmth around the wound site and difference in secretions and smell. If you believe you are infected, please see your primary care provider or go to the emergency department. These are my references. Feel free to look at them if you want more in-depth understanding. And this is a YouTube video I looked to for artistic schematics. Thank you very much. Bye-bye.